those of this station, its staff, management, or sponsors.
Welcome to How to Stay Healthy, where we interview doctors each week across the vast medical landscape of cardiology, neurology, orthopedics, sports medicine, and primary care. Join us here for your prescription to better health. Hello, South Florida and beyond, and welcome to the How to Stay Healthy show. December 28th, 2018. I guess this is our last Friday in 2018.
That it is.
That it is. And we're back with Dr. George Botellho. Your fourth time on the program, I think, since September 28th. So
fantastic.
Welcome back.
Thank you.
It's been a nice run, and I know you're starting to get really busy. I'll pull that mic just a little closer, Dr. Botellho.
You bet.
There you go.
You bet.
I know you're getting pretty busy. We were just talking today. I'm so glad to have you back. Like I said, but 3 surgeries today, 2 epidurals, that's quite a day. And one of the comments you had is because this time of the year can be a little hectic. People trying to meet their, their health insurance deductible and whatnot.
Yeah, generally people are not paying attention to their insurance and their deductibles. And as time goes by, all of a sudden they realize they're coming to the end of the year. And starting the first of the year, they roll into a new deductible. And probably right around November, people realize that, and it's a sprint to the end. And that's where we're at. We're sprinting into this last week.
If they can.
Booking surgeries, booking MRIs, booking therapy, just booking about whatever they can to get it done before that new deductible. It just happens every year.
Yeah, I know someone who actually had surgery today as well, but not orthopedic. But tell us, if you can, what you can about what went on today, what types of surgeries, and why 2 of them need epidurals.
Yeah. Well, today I saw 2 patients that required epidurals in their lower back for lower back pain. One of them was a little bit more of a diagnostic dilemma. She's had previous fusion to her lower back, and she did very, very well from that. Actually, kind of a fun anecdotal story. A woman came in, and she was complaining of left-sided lower back and buttock pain. And as I'm talking to her, this is an old patient of mine who came back after a number of years. I'm looking at her x-ray, and as I'm looking at the x-ray of her back, I realized that she had metal in her lower back from her previous back fusion. So as I'm looking at the x-ray, I said to her, how long ago was your back done? She says, you don't remember when you did my back? And I had done her back fusion about 12 years ago.
Wow.
And as I'm interviewing her and going over her back problems, she also told me that she was having some right-sided wrist pain. So I looked at her wrist, and she had some arthritis involving the base of her thumb. So I went to look at her opposite side, and she had a scar. And I said, oh, so you had this side done? She says, well, yeah. She said, you did that one about 8 years ago. And she says, it's still perfect. I don't have a problem with that. And she says, and don't forget, you did my left shoulder as well. So this is a woman I've been taking care of for many years. She just came back to me years later. She was a bit of a diagnostic dilemma because she was having pain into her left lower back and left buttock when she stood and when she sat. Mm-hmm. And as long as she unweighted her left side, she got relief. So I looked at her x-rays, and she had 1 abnormal disc a couple of levels above. So I injected her probably about 2 to 3 months ago. And she did get better. At that time, I injected her with PRP, platelet-rich plasma. But this time, her pain came back a little bit quickly, so we got an MRI on her and realized now that she had stenosis, or narrowing, of her spinal canal on only the left-hand side at 2 levels, not 1 but 2 levels. And this was a case where the patient was having pressure on her nerve root on her left side because of the bulging discs. Now, the disc was not inflaming anything, it was squeezing, and because it was squeezing the nerve would swell and cause pain. It's much akin to someone who breaks their wrist. And everybody has heard this story because somebody in their family have had this done, where somebody breaks an arm, like especially a child, they get put into the cast, and the next thing you know, the cast is too tight. Mm-hmm. Now, every time a patient leaves my office with a cast on, their cast is fine. But almost 50% of the time, I get a phone call in the middle of the night that all of a sudden the cast is too tight. Now, the irony is the cast doesn't change because it's now dry and it's now solid. But when you hang your arm down, or the arm is inflamed, or the arm swells because of the fracture, now all of a sudden there's nowhere for the swelling to go. So now the cast is squeezing on the arm. Well, the same thing happens with the nerve root. The nerve is being squeezed because the nerve swells. So in her particular case, the PRP that I did on her 2 to 3 months ago, or more, is not as effective as cortisone. So she got cortisone injections at the nerve roots at both levels today. And in the recovery room, she already had complete relief of her pain.
Wow.
Yet there was
That
another
quick.
patient who had arthritic discs and inflammatory changes that were going along with that. And he actually got PRP injections today. And I expect that he'll do well with PRP and it might last longer. But two different problems with two similar yet different solutions. They're quite similar. They're both epidurals. But just like with cortisone versus PRP versus maybe other types of things that could be given for an epidural, there are many different types of epidurals as well, and it depends on what the problem is. So, you know, each person has to be taken individually and treated in light of their problem, as opposed to just blanket treating people, which is kind of the way medicine is seemingly becoming.
Yeah, definitely.
You know, instead of being really focused on the individual and their particular problem, you know, everybody is being treated fairly similarly, and it just means most of the people get better, but not necessarily all of them.
Well, that's quite a testimonial. I mean, they're recovering in your recovery room.
Yeah,
I mean,
they
that's
feel
great.
better already.
And we're going to get into a little bit more about the VIP treatments that you do, but I just want to say thanks for the surgery synopsis, because it's just very informative, and it's actually fascinating to hear a doctor who just came out of surgery today.
Even another young woman that I took care of today, she's a person who is on her feet all day. She's a banker. She works in a bank on hard floors, and she's having difficulty tolerating shoes because she has a bunion. So I fixed her bunion today, and bunions seemingly are simple, but they're not so simple. I have to give podiatrists credit. I have to definitely give them a thumbs up, because bunions are tough. They're not easily treated. Everybody thinks that it's just a bump on their toe. And it is a bump on their toe, but it oftentimes is because the bones are no longer straight and they're not aligned, so they need to be realigned properly. So they don't. They expected today that all I was going to do was shave away a bump, but if I just shave away the bump will come back unless we realign the bones. So I ended up cutting one bone in her large toe in two different places and realigning it. So kind of fun for me. I hope it's going to be fun for the patient ultimately. The first couple of days will be a little tough.
So 2 back procedures and a bunion procedure today.
Yep.
Where do you do these procedures at?
I like to do the majority of my procedures through outpatient centers. Outpatient centers have lower infection rates than hospitals. Hospitals generally are where people go when they're sick, and I don't have a lot of sick patients. I just have patients who are older and patients who are semi-broken, so to speak. You know, they have arthritis, they have rotator cuff tears, they have a herniated disc. They're not really sick, so I don't want them to be exposed to those people who have pneumonias and gastrointestinal infections and being subject to MRSA or MRSA infections in a hospital. So I tend to do the majority of my work in outpatient centers because we see much lower infection rates there.
That's great news.
Yeah.
And those are also known as ASCs, or ambulatory surgery centers.
Correct.
I've been
Absolutely
doing my homework. I've been doing my reading. I've
Yep.
been reading a lot about them because that's quite a business in itself. And we actually had someone pitch into this show for a while. Had 4 doctors in a row from ASC, so that's great. We're here with Dr. George Botellho, orthopedic surgeon, with offices or locations in Key West, Boca, and Orlando. All 3. Wow. I was telling a coworker that today, and they couldn't believe me. I said, well, he started in the Keys. You got to watch the show.
Yeah.
And you got to see why he came to Boca and why he still does Orlando. And they were set on the fact that you have a small plane or helicopter. And I told them, I think I asked you on the air, and you don't.
Nope. Do not.
You enjoy driving?
I do enjoy driving. I really do. I really do.
Me too. I do too.
Yeah. I've been in the Keys since 1993, came up to Boca in the early 2000s. Well, actually up to South Florida and Palm Beach in the early 2000s. Started going up to Orlando probably about 5 years ago. Now, one of my sons is in graduate school in Orlando, so it's always nice to get up that way and hang out with him.
I was just up there. It's changed a lot, but it's nice.
It has changed a lot.
It's a futuristic city, what's going on. You can tell it's moving forward. And
so much expansion.
Yeah, it's going to be the next big thing in Florida.
Yeah, Orlando is big and growing.
For sure. But that's quite a swath of South Florida and Central Florida that you cover. It's InjurySpineInstitute.com. That's where I'm getting a ton of this info. And thank you for posting those radio shows up there. They look great on your site. I always tell people when doctors have a great site, and this is top-notch. This has got to be top 2 that I've seen in my 3 years of doing this. Ton of info on there as well. It's InjurySpineInstitute.com. Dr. Botellho is located at 9033 Glades Road, Suite D, Boca Raton. And we know from this show that's the PNC building on the northwest side of Glades Road.
Sure is.
I got it right today.
Sure is.
I'm thinking the intersection in my head. But that's a great central location as well. Joint replacement, both primary and revision, board-certified orthopedic surgeon. He talked a little bit about PRP, epidural before. That's platelet-rich plasma injections. Also does stem cell therapy as well. I think you said once on the show, I've been watching a lot of the shows, from the chin
to the toes.
To the toes.
Yep, from the chin to the toes.
I remember that quote.
I have almost everything covered, almost.
Yeah. Do you find that nowadays your age range of patients that you're treating is more of that baby boomer population or
I do find
elder?
Yeah, I do find, but we have a growing population of Medicare patients. So even as time goes on with the baby boomers being a large portion of the population, we find that the elderly is just growing. They're living much longer. And as these baby boomers move into that population category, we also find that they've been a lot more active. And therefore, there's a lot more wear and tear on their bodies, including their spines and their joints.
That arthritis over the years.
Yep, and they're more affected.
Keeping you in business.
We're a different population than our parents were. We really are. We do different things.
And we know what to do to have a better quality of life. We know we got to go see the doctor. If there's a non-surgical treatment option available, any orthopedic surgeon will tell you they will use it first. It's not all about doing surgery.
Correct.
But to get to that point, they will, study the body and find the best, path to relieve that pain and get a better quality of life. But people are playing golf longer, tennis, so many hobbies and passions in South Florida, just getting out there and enjoying it. So that's definitely a good card to have in your Rolodex is Dr. George Botellho, if you ever have any of those
For
issues.
anyone who still has a Rolodex.
Yeah, I've been saying that a lot lately. I still have one. I actually take the business card and staple it in there like we used to.
Yeah.
I was a reporter first, so I still use the landline and the Rolodex.
Yeah, it's tangible. It's something that you can touch. It's kind of like reading a book versus using a pad, an iPad to read. Very different. Very different.
Well, hold that thought. We're going to take a quick break. We're already halfway through. I'm going to ask you on the other side a little bit about the VIP treatments, cost, pricing, etc., insurances you take in your office. And then what's new? Think about it. What's new for 2019? What are your goals? What are the trends you see on the How to Stay Healthy show?
Very good.
All County Healthcare, Inc. is locally owned and operated, serving the Tri-County area, Palm Beach, Dade, and Broward counties for the last 25 years. The practice of medicine is changing dramatically. All County Healthcare, Inc. still does it the old-fashioned way, where our nurses and healthcare professionals come into your home to service your medical needs, providing you the fastest and best care possible. For more information, call 954-717-7027. And remember, Medicare Home Care is covered by Part A of Medicare with no out-of-pocket cost to you. It's your decision, and only your decision, on what healthcare agency you use. Call today. All County Home Health Care, Inc. at 954-717-7027. License 200999096.
Getting older is not for sissies. That's what one of my patients says. And it's funny, but it's true. Live long enough and you'll get arthritis, skin cancer, probably one of the common chronic diseases like CHF, COPD, diabetes. At All County Healthcare, we teach you how to manage your disease. We make sure you know how to take your medications and how to recognize signs and symptoms before requiring hospitalization, no matter how many visits it takes. You didn't move to Florida to be sick. You moved here to enjoy the rest of your life. And that's exactly what our team of nurses, therapists, and aides at All County Healthcare help you do.
And now back to How to Stay Healthy, your weekly doctor's interview and prescription to better health. And we're back, South Florida and beyond. Welcome back. We're here with Dr. George Botellho, orthopedic surgeon here in Boca Raton, the Florida Keys, and Orlando as well. InjurySpineInstitute.com is the website. You'll find all the info there. I was saying a little bit before, and I know we touched on this in the past interview, but you're not about high volume. You're more about the VIP treatment. Explain that a little bit.
Well, I learned the hard way many years ago. I was seeing so many patients in a given day that it was stressing everybody out in my household. So I decided to kind of rethink how I practice medicine. And an idea kind of hit me where instead of trying to just churn out numbers on a given day, it had to switch from volume to value. And what I mean by that is that patients who come in, they're seeking guidance with regards to their health, especially their orthopedic health in my case. But even with regards to that, the other day I had a patient who came in and he was having some bladder issues. And he had not seen a specialist for his bladder, but I prescribed him a medication that I'm pretty familiar with for his bladder, and now his bladder symptoms have largely resolved, yet I'm his treating orthopedic surgeon. The whole idea is when patients come into my office, I really want to learn about them as a patient, not just their single orthopedic complaint. Mm-hmm. And that's just what the doctors are doing these days, and that is a patient comes in with finger pain. Okay, let me focus on your finger pain. Let me focus on your knee pain, whatever the individual problem is. I don't want to do that in my practice. In my practice, I want to create a problem list. And in orthopedics, I always think that I can do like I do at home. When I'm at home and I have things to repair around the house, I create a list. And I tackle that list one item at a time until I'm able to take it off the list. And that's what an orthopedist should do for his patients. And that is very simply by creating a problem list and addressing each of those problems and see how many of those problems you can take off the list, not just add to another list. And as I started developing this concept, I realized that, instead of seeing patients every 5 to 10 minutes, I need to see patients roughly every 30 minutes. And some patients may take an hour, another patient may take 10 minutes. But the whole idea is that I need to see a patient, I need to listen to the patient, I need to look at any diagnostic study, whether it be an X-ray, an MRI, a CAT scan, even lab work. But I need to look at those pictures. I need to look at those results, not look at a report. Mm-hmm. Because if I'm looking at a report, I'm looking at a problem through somebody else's eyes. And that other person's eyes, okay, let's say we're looking at an MRI. That other person is a radiologist. But they're coming to see the orthopedist for an opinion, not the radiologist. So, again, just looking at a report doesn't do the patient justice. So I find that we take our time with patients. We don't numbers crunch patients in a given day. We don't see big volume. We see relatively small volume. But we spend a lot of time with our patients. Our patients get our phone number, and they are able to contact us day or night. And we can respond to their problems, and I can come and see them even on weekends. I'll come in and see patients on Saturdays. I've come in and I saw one patient once at nearly 10 o'clock at night on a Sunday night because it worked for him. So we did exactly that. But that's my idea of VIP medicine. And in my practice, I don't have a VIP practice like many doctors do. I have a medical practice and an orthopedic practice. It's just that we treat it like a VIP practice. Every patient is a very important patient in our practice.
VIP treatment.
Yep.
I like that.
And that's what they get. And there is no fee on an annual basis. There's no enrollment. There's none of that stuff. If they're in network, if we are in network with their insurance, that's just the treatment that we give. That's it. That's it.
Now that number Dr. Botellho mentioned, 1-888-585-7777. 4 sevens there. 1-888-585-7777. Nice. Easy to remember that.
I like sevens.
I see that.
I like sevens.
Do I need a referral to see you? I mean, do I have to go to my primary care first, or can I just call you up or go on the website?
Nope. All of our insurances, because of the way we're networked in our insurances, we do not need referrals from other doctors.
Oh, nice.
If patients need referrals, that means we might not be in their network.
Yeah, because it's a lot of running around to get those referrals and whatnot. So
It can really make a difference. I saw a woman recently. She's having insufferable back pain. I ordered an MRI. She can't get the MRI because she had to go through her medical, and her medical was booked up through the first of the year.
yeah.
So she hasn't had her MRI yet, and she's struggling and having a hard time getting around. So my hands are they're tied, but this is what the insurance companies require, and there's no way around them.
Yeah, just like you're busy with, people getting their surgeries before the end of the year. So insurance covers it. Also MRIs are busy, primary care. Those roads are busy.
Oof,
I love
that coming today.
I love the state of New York, but that orange license plate, I've been seeing a lot of that this week.
Sure.
Not New Jersey, though, so not this week. Where's all the people from New Jersey?
They'll come down
New
soon.
York.
They'll come down soon. I don't know where my family is. They haven't come down yet.
Yeah.
All from New Jersey.
I seen today, talk about my list. I was jotting down, they're doing a Woodstock, 50th Woodstock in Bethel,
Really?
New York. Yeah, I just saw it. Neil Young's playing. There's a little rumor Pearl Jam may be playing, so.
Yeah, there's a bunch of great concerts that are going on. The Stones are coming.
Yeah, I saw that.
That's a big one.
I saw them back in 2005 up in Hartford, Connecticut. Rentschler Field, where UConn plays. And a little known band at the time opened for them. Very popular today. Had no idea who they were at the time. Maroon 5.
Oh, yeah. Oh,
Adam
my
Levine.
gosh, yes. Yeah,
What a
yeah,
show.
yeah.
August 2005. But I'd like to go again, but I think that one may be out of my range with a 17-month-old at home. We're here with Dr. George Botellho, injuryandspineinstitute.com. He's a board-certified orthopedic surgeon right here in Boca Raton, Orlando, and Marathon in the Florida Keys, my favorite island in the Florida Keys. There's a lot I like about you.
Thank you.
Yeah, thank you, and thanks for coming back. Fourth time we've had him on this year, so that's great. What's new for 2019? Any goals or trends? Or it can be anything. It doesn't have to be orthopedic surgery. I mean, what's new?
Well, let's talk since you mentioned
Put you on the
orthopedic
spot.
surgery. What's trending in orthopedic surgery? One thing that people have to start thinking about more and more and more, we don't have time, but that is preventative medicine. Preventative medicine is huge, and that is avoiding problems before they even start. And earlier we mentioned something about vitamin C, and a lot of people will come in and they'll say, well, they have vitamin C. They drink a glass of orange juice when they remember every once in a while. Well, you know how important vitamin C is for the immune system and for metabolism and for diet, etc. Vitamin C is so important, and just adding 500 to 1,000 milligrams of vitamin C in one's diet every single day is so healthy. Something I do every single day. I also take fish oil, 4 grams of fish oil every single day. Plus another thing that's great for bones is something called vitamin K2. Okay, not vitamin K, but vitamin K2.
I'm going to jot that one down.
And vitamin K2 is great for osteoporosis and osteopenia, and it's something that's available over the counter. So preventative medicine is very, very important, and we constantly see orthopedic surgery just developing. There's a whole... Even we've spoken about stem cells and PRP and platelet-poor plasma and all these different things. It's such a science that only the tip of the iceberg has truly been uncovered, and we have yet to see where it's going. In fact, someone with whom I work, he's been doing some work with the veterinary community up in Palm Beach with regards to stem cells and platelet-rich plasma, where these horses that have really been doing a lot of show work and a lot of competing, their joints are taking a beating, and lo and behold, the stem cells are helping them tremendously as well. So it's not just us in the human world, but also in the veterinary world as well. So we're really going to see a lot of growth with regards to that.
That's good to hear. And do you find with fish oil, we got about 2 minutes here, you find with fish oil for yourself when you take it, a lot of people say they get like a little indigestion or something comes up, but that doesn't happen with you?
People have to try different preparations.
Yeah,
I've had that, and I have gone on Amazon, and I tried various ones, and I finally found one that seems to not bother me. And I have gastritis, and I have a history of an ulcer, yet my fish oil almost never bothers me. I'm almost never aware of it. I don't get that repeat flavor or taste of the fish. So try different preparations until you find the right one. Don't drop it, because it's very good for you.
Well, it's hard to believe we ripped through another 30 minutes last Friday of 2018. I hope you have a great 2019, Dr. Botellho.
We didn't have a chance to say, but I wanted to wish everybody in our beautiful Boca a very happy Hanukkah, a very Merry Christmas, and now, above all, a very safe and happy New Year, and may 2019 bless everyone in our wonderful community.
Thank you, and you're always welcome on this program. We'll see you Tuesday night, 6 p.m. right here. For a prescription to better health from the top doctors in the medical fields of cardiology, neurology, orthopedics, sports medicine, and primary care, join us each week on the How to Stay Healthy show.